Why is patient education on communicable disease prevention essential? So just to make sure we understand this question, a communicable disease is like a contagious disease. So any sort of illness that we could easily spread to other people, easily, maybe through the air, through surfaces, anything like that. So we're not talking about a disease that's genetic or some sort of disorder that a patient just acquires on their own and cannot be contagious or spread. And now we're looking at the prevention aspect. So we're educating our patients on how to prevent the spread of disease. That's basically what this question is asking us. So option A says to ensure patients comply with prescribed medications for existing conditions. And that's not really what the purpose of this idea is. The idea of patient education to prevent communicable disease is educating our patients on a way that they could stop the spread of an illness, and they could also protect themselves from getting that illness. And while it's important that they comply with their prescribed medications, that's not really part of this topic of stopping the spread of communicable diseases. So we can eliminate option A. Option B says to empower patients to advocate for stricter hygiene protocols in healthcare settings. And maybe some patients might feel so inclined to do so. Maybe that's something they feel passionate about, changing policies and protocols, but that's not really the reason why we're empowering our patients. Overall, the purpose of everything we do with patients is to keep them safe and healthy to the best of our ability. So even though that might be nice if they decide that they want to get involved in policy work or in healthcare themselves, that's not really our job to try and get our patients to do something like that. So we could eliminate option B. Option C says to equip patients with the knowledge. So this is starting off sounding good, giving knowledge because this is part of education, and skills to interrupt transmission pathways of communicable diseases. And that makes sense because why do we teach our patients anything? It's because we want them to be able to use that knowledge to protect themselves and the people they care about. And for that reason, if we're educating them on prevention of disease, we hope that they could use those skills and that knowledge to keep themselves and their families and friends safe. Therefore, option C is looking like a good option. But let's look at the last choice here. Option D says to alleviate patient anxiety associated with potential exposure to contagious illnesses. And remember, we're looking for like the primary to best reason. So although education is definitely useful in alleviating patient anxiety, and probably once they have the facts and they know how to protect themselves, they'll feel more comfortable. The main reason is just this overall idea in option C that we want to equip our patients with the skills to interrupt the transmission and protect themselves and the people they care about. So option D might be a side purpose, but it's not the main purpose. So we can eliminate that, and that leaves us with option C.